Diarrhea. What's the best treatment for diarrhea?
The best treatment for diarrhea is electrolytes. Electrolyte, well-balanced formula with about 2.5% sugar. Anything higher than 2.5% sugar in it can contribute to the diarrhea because the sugar goes right through you.
So the Pedialyte type form was designed specifically for diarrhea?
Pedialyte is designed for diarrhea. In the event of do no harm, if you wanted to hydrate a child on your way, before you got to a hospital emergency room, probably the safest thing would be water, because you're not adding sugar that may make the diarrhea worse. The best thing, if you want to buy something that's in the supermarket that has been designed for diarrheal losses, I would have to say that that's what Pedialyte is designed for.
Is tea with a little bit of sugar okay?
Tea with a little bit of sugar is okay. Your main loss during diarrhea is sodium. Conserves potassium and tends to lose more sodium.
Is there any particular drinks that are a pretty good source of sodium?
A homemade remedy that would be good for diarrhea would be orange juice diluted with water.
That's a good source. So in other words, put in more than it's coming out the other end, you won't get dehydrated.
Basically, you want to make sure that the sugar in the orange juice is not too high. There will be potassium in it. So basically, you want a very, very, very dilute orange juice. You can make your orange juice go very far.
You want to keep the sugar below 2.5%?
Yes.
So if you see it's 5% sugar, it's going to give you more trouble?
The first thing you're going to lose when you have diarrhea is the ability to absorb milk sugar. So anybody with diarrhea should be off milk products. Now the next thing you're going to lose is table sugar, sucrose. So you do want to keep that under 5% depending on the length of the diarrheal episode.
And as the diarrhea gets better, you want to get protein back in the diet, because if you don't get enough protein, you probably can go to a chronic phase.
When you're having diarrhea, you actually want to encourage the absorptive surface to regrow back. So you can actually stimulate the gut by giving it protein, carbohydrates in the form of a little bit of milk products that will actually stimulate the intestinal surface to regrow.
So if you don't give a kid enough protein, you can actually get a chronic non-specific diarrhea?
Yes.
And that was coined many years ago, I think, a guy named Murray Davidson. But he felt that was a risk factor?
As far as needing protein, you could probably start, well, it depends on the age of the child. A young child, you're not going to go 24 hours without protein. An older child with a fat reserve who gets diarrhea, you probably could go 24 hours before you start breaking down a significant amount of protein.